An update on Singapore's ICU capacity also shared in Parliament today. Of the 219 ICU beds currently reserved for COVID-19 patients, around 60% are occupied. As at yesterday, there were 130 COVID-19 patients needing intensive care, 61 critically ill and 69 needing close monitoring. As for non-COVID-19 patients in ICU, public hospitals here currently operate about 163 adult ICU beds, with an average occupancy of nearly 80%. Senior Minister of State for Health Janil is saying that over the past 2 months, the total number of ICU beds for COVID and non-COVID patients has been increased to 382. And if needed, another 350 beds can be added through repurposing existing hospital wards. But in doing so, Dr. Janil says any increase must be supported by more staff members trained to care for these ICU patients.
The most important limit is the manpower required to staff ICU beds. Patients in the ICU need trained staff who must be able to provide individualized care, including round-the-clock monitoring and continuous care. So any increase in ICU bed capacity must be supported by an increase in manpower, which has to be diverted away from non-COVID ICU duties. Any redeployed staff or new hires also have to undergo training to operate specialized equipment and medical devices in the ICU in order to care for the COVID-19 patients. Logistically, we can keep stepping up our ICU beds. We have ventilators, we have equipment, consumables, all the things that are needed, but not enough people. As a result, if we keep increasing our beds, we stretch our healthcare workers. We will come to the point that they will no longer be able to provide that continuous excellent care. Our nurse-to-patient ratio will be lower, which means each nurse will have to take care of more patients than they do today. In a normal ICU, peacetime, pre-COVID, one nurse will look after 1 or 2 patients. If she has to look after 4, she will not have enough hands or time to provide the same level of care.